Now that we have talked about what we plan to achieve in this session and we have completed the exercise, I would like to share some information about trauma. Trauma affects people in different ways. The majority of people recover from the effects of a traumatic experience after a reasonably short period of time, according to Ojoleto and Abramowitz in 2023. Only a few people suffer with ongoing issues. People who have not experienced what you have experienced may not understand the magnitude of your trauma or your response to it. Some people who have experienced trauma similar to your experience may also respond differently. Moreover, some people who have had traumatic injuries are at a greater risk of developing drug addiction problems, having a greater chance of being repeat offenders of crime, having low levels of contentment with treatment for pain, and having minimal involvement in care after trauma, according to Sinkler et al. 2022. I want to stop and say thank you for showing up to treatment today. It is difficult to determine how a person will respond to a traumatic experience until it happens. Still, it has been shown beyond a reasonable doubt that being exposed to traumatic events raises the likelihood of developing a variety of psychological illnesses, according to Rossellini et al. In 2018. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, also known as the DSM, which was published by the American Psychiatric Association, also known as APA, in 2013, listed trauma-related disorders as post-traumatic stress disorder, also known as PTSD, acute stress disorder, also known as ASD, adjustment disorder, reactive attachment disorder, also known as RAD or RAD, which is diagnosed only in children. Then disinhibited social engagement disorder, also known as DSED, which is also diagnosed only in children, and other specified trauma and stressor related disorders, and unspecified trauma and stressor related disorders. Symptoms manifest in different ways. Some common symptoms of trauma, as listed by the DSM-5 in the APA 2013, include hypersensitivity to physical contact. This is what we would consider a physiological response. Autoimmune disorders, which are medical responses. Cognitive issues, such as difficulty processing new information. Issues within relationships, such as uncertainty about and or distrust of people around you. Issues with behavior, such as difficulty following rules and having low self-esteem, which is an emotional response. This list is by no means exhaustive, but if you are experiencing any of these symptoms, you may find it useful to speak to a psychologist to learn more. Also, as I mentioned earlier, because of the effect trauma may have on relationships, it may be helpful to include your support person in discussion with your health and mental health care providers. This is especially true for those of you who may have experienced some form of betrayal. For those who have experienced a devastating betrayal by a significant other, the results of Tyrone et al. Study in 2021 implied that support from others could serve as an especially crucial protection against the symptoms of trauma.